Rabies is an infectious disease that destroys the nerve cells of the brain and almost always causes death. Humans and all other warm-blooded animals are susceptible to this disease. Rabies is caused by a virus that lives in the saliva of a host. Most mammals can carry the rabies virus. If the carrier bites another animal or human, or if some of its saliva enters an open wound, the victim may get rabies. Humans and other mammals can catch rabies by breathing the air in which rabid animals flock. The virus can enter mucous membranes, for example those lining the nose, but it cannot invade unbroken skin. Dogs, cats and wild animals are sources of infection in humans. When the virus enters the body, it travels on the nerves to the spinal cord and brain, causing inflammation. When symptoms appear, death is usually inevitable. Symptoms develop from 1 week to 1 year after exposure. Among the first symptoms in humans are pain, burning or numbness at the site of infection. An infected person complains of headaches and is unable to sleep. Muscle spasms make the throat full and swallowing becomes difficult. Due to the inability to swallow water, rabies is also called hydrophobia. Later, the patient may have convulsions. After a day or two, a quiet period occurs, which progresses to unconsciousness and finally death. The disease lasts from 2 to 12 days. In dogs, the disease follows the same patterns as in humans. During the period of excitation, the dog may wander long distances. It is aggressive, growling and barking almost constantly, and will attack without reason. From this stage, the disease usually progresses to general paralysis, then death. Some rabid dogs never show signs of the excitation phase, but only of the paralysis. Paralysis of the jaw and throat muscles are characteristic. The most important thing is to prevent the disease by vaccinating all dogs and cats. A person bitten by any animal should immediately wash the area well with soap and water. The animal either should be confined and observed for signs of rabies, or killed and its brain tissue examined for rabies virus. If either procedure indicates the presence of rabies, a doctor should begin preventive treatment immediately. If the animal cannot be found, the doctor should decide to follow such treatment as a safety measure.